Okay, so good afternoon, everybody. And today we are going to actually do a very interesting topic, psychiatric treatments in special population. So you see, we see a variety of patients, and we can't treat all the patients the same way. Like if you get a patient who comes and tells you that I'm pregnant, I'm 2 months pregnant, will you give her the same medication? Or if a child comes to you with similar presentation, child comes to you with depression or schizophrenia, so again your treatment will not be the same as adult. You won't give the same doses as adults, and obviously you won't give the same medications also as adults. So you need to change your strategy, you need to change your methods when you are treating some special populations. So for today's lecture, we are going to cover the treatment of psychiatric symptoms in children and then in pregnant women, because there are a lot of pharmacokinetic changes in these patients, and we'll be learning what these changes are. So first we'll see what are the differences in children, and the part 2 of this lecture will be concentrating on pregnancy. So first in children, what are you supposed to do? What is the first step? So first you have to do an individual assessment of the child. So first assess the child, but then you have to discuss with the parents or guardians also. In adults, you just discuss with the adults or just take consent with the adults, and that is enough. But in children, you have to do things twice. Once with the child and then with the parent also. You have to have frequent monitoring. The child is growing, so you have to call him for regular follow-ups also. And always calculate a risk versus benefit in these cases. So balance the risk and benefit. You should know what are the possible side effects of the psychotropic medications, what are the risks if a child takes this, and of course the benefits. And that is what you're supposed to tell the parents also, that these are the risks, these are the benefits, and then both of you are supposed to decide. In fact, a lot of people ask that बच्चों में psychiatric medication देते भी हैं क्या? This is again a question which is coming to your mind. So do psychotropic medications, that is the psychiatric medications, do they interfere with normal development? Do they lead to long-term side effects like lifelong side effects? Can they occur with these medications? So research is very limited, because not everybody would want to volunteer their children for these researches. So we don't have a lot of research. That is why we have to use a lot of caution. So use caution, especially as the child is smaller and smaller in age, your caution should increase. And if you're thinking of a long-term treatment, then again be very wary of the side effects. So this is a very simple diagram. It explains the whole lecture actually in one slide. So whenever a child comes to you, what are you supposed to do? First, conduct a comprehensive diagnostic evaluation. See, diagnosis is very important. Don't be very enthusiastic in a hurry to treat a child. First, make sure that your diagnosis is correct. So conduct a comprehensive diagnosis. Ask this question: does the child have a condition like psychosis or mania for which medication is necessary? So a lot of times anxiety, learning disability, all these things don't require medication. So if it doesn't require medication, you go to the next step. But psychosis and mania do require medication. So if it is yes, you start medication. If it is no, then what do you do? If it is no, think of a psychosocial intervention. So we have counseling, we have cognitive behavior therapy, we have remediation therapy. So we have a lot of other options. So see if a effective treatment is there. If it is yes, then send the patient. If the psychosocial intervention like counseling If it is effective, then there is no need for medication, just give counseling in that patient. But if it is not effective, so then again you have to think if there is some medication available. If medication is available, then yes, you can try and use it. If medication is not available, then there are a lot of other options also. We have a lot of alternative therapies, so you can go ahead with that. So this is like an algorithm which will help you in any child case that comes to you. So just going through all the steps again. So do a comprehensive diagnostic evaluation, inform the patient and the child to the potential benefits and risks. Okay, and then also give them the alternative options. If you're using an off-label use, like a lot of times antidepressants have a sedative effect. So if you want the child to sleep properly, sleep nicely, we use it as an off-label use. So whenever you're using a off-label medication, just inform the parents also. Symptoms should be kept in mind that these are my target systems and this is what I'm going to focus on. Um, After you have started medication, you need to monitor some things like weight, height, blood pressure, pulse rate, cholesterol levels, renal functions. So all these parameters should be done before medication so that you have a baseline, and then after medication regularly you have to keep monitoring these things. Start medication at a dose which is the lowest effective dose, lowest possible dose. In children, you have to use very, very low doses. Monitor the side effects, adjust the dose. If the patient is getting side effects, you can lower the dose if possible. If there is improvement, you can try and increasing the dose, but be very, very careful. Then once the maintenance dose is fixed, continue it, whatever duration according to the illness, you continue the medication. And then after the medication and the duration is complete, then you can decide if you should stop the medication or continue it. So it is on your clinical skills. Once you're discontinuing the treatment, examine the need that should you gradually taper. Most of the psychiatric medications cannot be stopped abruptly. You need to decrease the medication slowly and then stop it. So don't discontinue it abruptly. Lower the dose, taper the dose, and then stop it. These are some medications. This you will be learning in the individual chapters also. So in ADHD, these are the medications which we give in children. If a child has OCD, we give fluoxetine. For depression, we give sertraline. This is just rote learning. So you can go through this lecture again, and this will be very, very short term in your memory currently, but you can go and read it again. For major depression, we have again escitalopram. For OCD, sometimes we can give clomipramine also. In psychosis, hyperactivity, haloperidol is given. These are very common drugs. You should know the name of at least one or two drugs. So again, go back or see this lecture on YouTube again and learn these by rote learning. There is no other option. Uh, this list again for bipolar mania, we have listed some medications and comparing with adults also. Like TCAs, we do not give in children. SSRIs we can give, antipsychotics we can give, and methylphenidate and other amphetamine-based stimulants we can give in children. So just remember this, or if anybody has extra interest, you can go through this, but just keep an idea. So with this, we conclude the child part of the lecture. So medications are important. They have a role in child psychiatry, but more research is needed for the long-term effects, and clinicians need to stay informed. So every day new research is coming up and we need to know what is going on in child psychiatry. Now coming to what to do if a pregnant patient comes to you. So how do you handle a patient who is pregnant? So psychotropic medications we know are medications used in mental illnesses. Many pregnant patients may need to continue or they may need to start psychotropic medication. For example, if a patient has psychosis, patient has schizophrenia since the past 1 year and then now she becomes pregnant, what do you do? Or during pregnancy, if a patient develops psychosis or schizophrenia, what do we do? Just like in child psychiatry, we balance the risk and benefit, and here our focus is the health of the baby and health of the mother both. So we have to look at the risk to the baby, risk to the mother, benefit to the baby and benefit to the mother. So here you are doing double calculations. So the safety of these medications during pregnancy is an important consideration, and they are commonly used. So it's not like if she's pregnant, so suddenly you're supposed to stop it. We have a lot of useful medication. So decision to use psychotropic medication during pregnancy is based on weighing the risk and benefit. Again, untreated mental conditions can have a negative effect on both the mother and the child. So yes, if a patient has depression, patient has schizophrenia, if she continues the pregnancy untreated, there are a lot of risks. So you have to keep those in mind also, and keeping those in mind, treating is essential. You can't just stop medication. And best if the patient consults a psychiatrist or a patient consults a healthcare provider, we can tell them the risks and the benefits accordingly. And you can't just give a blanket statement. Each and every medication has their own safety profile. So I'll be telling you what medications are safe, but just keep in mind that you can't apply the same principle to all of them.